Welcome to the Educate and Empower podcast, where we educate the community around healthcare and a healthy lifestyle. Welcome back, everyone, to the Educate and Empower podcast. I'm your host, Rebecca East, nurse practitioner, CEO and founder of the Holistic Care Collective. I am so excited to be bringing this session to you today with our dear Sophie. Sophie is a registered nurse and an expert on all things pelvic floor. And I think it's just time to jump on in, Soph, and tell us a little bit about yourself. Who are you, and what's all things pelvic floor?
I've been, like you said, a nurse for 30 years. Really love nursing. If I had my time again, I'd still be a nurse. I really love the connection that you get with the people, the good, the bad, and the ugly. I originally did paediatrics for 20 years. I've got a grade dip in peds, but just wanted to get back to doing some adult nursing, and I've ended up in community. And although you get a range of ages, you also get a lot of people that are aging, but not necessarily aging well. And so I've we cross over a lot with continence girls as well. So there's a lot of incontinence in the community, especially women. And I went into this business really knowing that these machines can make a difference regardless of your age. And I really am passionate about older people as well as younger people. I think we forget the older community. And if you're going to age, I think we've got to age better. We've got to do better.
100%. It's all about preventative health, which I don't think we do as a healthcare industry right now.
No,
And it doesn't look like we're going to be focusing it on in the future anytime soon. But
no.
preventative health is so important, and the pelvic floor is so important, not for just men and women. But let's talk about the misconceptions of the pelvic floor. What do you see some of the common misconceptions about the pelvic floor, particularly, as I said, we forget about the poor old men in this situation?
Yeah. I think people, especially women, they're aware they've got a pelvic floor, but they don't think it's going to be a problem until they have kids or go into menopause. And I suppose younger women are probably a lot more empowered than they used to be, especially my girls. I've got 3 girls, and they're very in tune with what's going on now. And I think that's fantastic, but I also think that there's a great deal of a lack of knowledge because I'm not going to be there for a while, so that's not my problem. Where it's really important, especially from your 30s onwards, because you start actually becoming perimenopausal then because your estrogen levels drop from about the age of 35 very slowly. But yeah, they do. So you really need to, especially if you've had a traumatic birth or you've had problems with your pelvic floors in the past, that you really need to get onto it now rather than waiting for later when your body can't compensate as well when you're younger. And especially for men, men don't even realise that they've got a pelvic floor. Like tradies, like men that have been doing heavy lifting all their life, not just men who've had a prostatectomy and then they've also got some incontinence after that. Men, because they don't have a uterus, obviously don't have that sort of prolapse, but they do compensate in other ways. They get hemorrhoids, they get lower back pain, which women do as well, and they also can get some leakage down the track. So it's quite complex. Your pelvic floor is just it's like a can of worms. There's so many things that can influence it, but it's so important.
Yeah, absolutely, 100%. Even you were talking about the tradies. I think a
Yeah.
lot of men, particularly, I was thinking about my husband. I'm
Mm.
sure he'll be really happy that I'm talking about him in this situation. But a lot of the men who jump from like trucks and stuff as well, and
Yeah.
from high buildings, I'm
Yeah.
sure that impact. I mean, they think about it from a musculoskeletal. So you hear about the sore ankles and the knees and the hips and the backs, but they don't think about it, as you say, from a pelvic floor perspective.
Mm.
Is that
Yeah.
something? Well,
Oh, definitely. But also men, like I shouldn't have just generalised then, men that sit, because my husband or has been doing a lot of sitting in the last 10 years in his role, and they don't use their core because you're sitting in the way that your pelvis is, in that position for most of the day. You actually really lose your core strength, which causes lower back pain as well. So your glutes and your abs and your pelvic floor are so interconnected, and it affects your posture, it affects your mobility. and your ability to like continue at the gym and continue with day-to-day life. Like we're just not as active as we used to be because we've got so much technology that can do things for us now,
Yeah.
and we're sort of paying the price a little bit, I think.
Absolutely, 100%.
Mm.
Um, and then we've got all the good old nurse's bladder that we all,
Yes.
we all hold on until the end of the shift or we don't get time. Um,
Yeah.
yeah, there's a lot of that, not necessarily misconception, but I think it's just that consideration, particularly for our industry. Um,
Mm.
we generally most of the time have to put our patients first, so
Mm.
that holding on is not necessarily a good thing.
No, definitely not. And I think the going just in case, because you're actually retraining your bladder to get used to that, where you're sort of doing yourself a disservice as well, because you're going the opposite way, where you're actually not holding on. You'll go, oh, I'm going just in case. Or, and it's so interesting when you do the consult when people come in. Like a lot of people will, like for Bendigo example, there's a couple of women that I've treated, and it's quite funny, really. Go to Target and feel like they need to go to the toilet because they know there's no toilet in Target. Like, do you know what I mean? You really
Yep.
not set yourself up for failure, or it's like when you get home and then all of a sudden you're busting to go
Yeah.
because it's such a mind connection with your bladder and your bowel, like everything is such a connection. And you think back when you were a toddler and you were trained, you know, to be able to hold on and go to the toilet. That's the same thing. You can actually really flip out into retraining yourself down the track as well. So that's something that's really important to be aware of.
Yeah.
It's not just using the machines, it's like it's a whole process of things that you really need to address to make sure that we're going to get the outcomes that people want. Yeah.
Yeah, absolutely, 100%.
Mm.
That's great. So why is it important that we focus on, particularly as I said, why is it important we now educate patients and the community on the pelvic floor? Like, why is it so pivotal for our longevity of our health?
But basically the whole like it's the whole framework of your body. Like it's how you move, it's how you breathe, it's how you do everything. Like your core strength is your foundation of your body. So as you get older, and it's really bad now that I've been doing these treatments, you're like, yeah, you've got a pelvic tilt. You could really do with some. Do you know what I mean? You stand back, you can actually see in line who's got great core strength, who's could really do with some pelvic floor work. It's just, yeah, it's you'll see it in everyone. And the one really fantastic thing that you see, especially when people do the quarter floor, and I do the before and afters, and that's purely for their benefit is their posture changes. Like it's amazing. It's the biggest thing that changes with these people. But you feel stronger. You feel like you've got that strength behind you to be able to get out of bed, to be able to lift your kids, you know, to be
Mm,
able to do everything. And without your core, you get lower back pain, you get, you know, your hips are out of alignment. It just takes one little thing and then everything else follows, especially as you're older. And if you're not going to the gym or if you're not doing, like if you're not an active person, then it's so true. If you don't use it, you'll lose it. So,
absolutely, 100%.
yeah,
Um, it's the good old nursing assessment in the queue at Target, as you said. Like,
yeah,
I quite often watch someone walk into the queue or walk up and down the aisles and think, oh gosh, they've got some mild to moderate OA in
yep.
their necks and
I
stuff.
know,
But
isn't it terrible? It's so,
yeah, it's part of our job. I don't think it ever leaves.
is. No,
Absolutely.
absolutely not.
So, what are some practical tips or strategies that our listeners could implement in their daily lives now to improve their pelvic floor?
Definitely, I would see a pelvic floor specialist if you're having issues because there might be more to it. There's so many complications, and it's really important to get a great assessment done by someone that will do an internal. And you have a front pelvic floor and a back pelvic floor, and you also need to know if you've got an overactive pelvic floor. So it's not just a matter of I've got leakage. We need to know what's causing that leakage as well. So it's not just a me approach; it's very much a team approach, and like it's not just the machines can fix you; it's you actually needing to engage back in this because as much as it would be lovely that these machines fix you once and for all, it's like going to the gym and then expecting, right, I've been to the gym for 6 months now, I'm heading off and I should be good for the rest of my life. Like it's a lifelong process. So definitely make sure that you drink plenty of water. Water is the key to everything, and I know that's really hard when you've got issues with incontinence, because especially when the clients come in, I ask them to drink more water,
Mm.
because like 1 to 2 glasses of water a day, and coffees doesn't, cut the mustard really. So yeah, there's just, I think, movement as well, but addressing it, like it's not, just knowing it's actually not normal. Like not everyone at the age of 40, 50, 60 has leakage. Like not everybody has leakage when they jump on the trampoline. Not everybody has problems when they have sex and then it's not painful, or it's a lot of people can actually be incontinent when they're having sex, so they just stop having sex, and that's really sad because these are people in their 40s and 50s that got a long way to go yet. So
Yeah,
do you know what I
absolutely.
mean? It's just,
Yeah.
if you think it's normal, it's actually not normal, and you can do something about it. That's not invasive. That's not scary, and it's not painful. Yeah, there's so much technology now.
Absolutely, and I want to come to the machines, but just on that next.
Yeah.
But on that, it's really challenging, right? I was actually doing some research yesterday about shame and stigma, and
Mm,
women, particularly women,
mm,
having those challenging, or what I would call is, well, what is described as difficult conversations. Now, obviously, as health practitioners, it's pretty easy for us to talk about sex and pelvic floor and incontinence, and but for the layperson or the community, some of those things can be actually really, really challenging, from a
definitely,
cultural perspective, a values, family values perspective,
definitely.
all of those things.
Mm,
I think finding the right person to have the conversation with is definitely really key to be able to do those type of things. Um,
definitely.
but yeah, it's as you say, if it's not normal, find out why,
Yeah,
and
absolutely.
even ask the question, if it is normal, then that's okay. But generally,
Yeah.
9 times, as you say, it's
Definitely, absolutely, and especially like after you've had babies, your
mm,
pelvic floors, like super important, but then they become less important secondary to your child and to your sleep.
yeah,
So as much as you know that you need to do these things, it really takes a back seat until you get your new life under control, or adjust to your new life even. So I
yeah.
think that happens, and then a few times people go on to have more kids, and then that actually never gets addressed. So um, it's really important to look after your pelvic floors. It's like any muscle,
Mm.
in your body, and that's a really important one because it's like a hammock for all your internal organs. So if you don't have that strength behind it, eventually things have to follow gravity. So unfortunately, yeah, sometimes that does happen.
Yeah, and it's I like that terminology of the hammock, for the rest of your internal organs, because it's actually very, very true.
Mm.
Let's talk about technology. You've got this wonderful machine called the M Seller and your M Sculpt, and the what's the other one called?
Oh, the Exodus. Yeah, that's just a
Yes.
really aesthetic, self-indulgent sort of thing, but it's actually fantastic.
Yeah, yeah. So
Um,
let's talk
so
about, like, I mean, it's not just about exercise anymore for these pelvic floors. How, like, explain what the machines are, what your business is all about.
yeah, okay. So I have a dear friend called Mon Cam, and she has GV Body Rejuvenation in Shepparton, and she's fantastic. We've both been educators at Golden Valley Health and Shep, and she brought out these new machines. And I was turning 50 and doing my bucket holiday to Greece with my family, and I just wanted to look the best. But I, coming up to 50, had been feeling super old. Like I just felt old, and like everything seemed to ache and joints and stuff. And I just thought, man, this is not going to be a great way to age. But I went and saw Mon just to help with my stomach, because I wanted to be able to be comfortable to get out of my bathers and get out there with my kids and stuff. And I did my abs and my glutes initially. And the change in my core strength was like almost immediate. It was insane because I got that structure back, and I
Yeah.
wasn't getting out of bed with lower back pain. I haven't had lower back pain since we started that. I moved better. I felt better. I was so much more confident in myself. And then with the MSELA, like I had been having, because I've had 4 kids, been a nurse for 30 years, all of the above. So I was starting to get a few symptoms with menopause and like a little bit of, gee, where's the toilet? Really have
Mm.
to stop and concentrate. And the MSELA was just ridiculously, it was like, I know game changer gets thrown around a lot, but it was fantastic because I got that total core strength back. And it's funny, like for some people, it happens instantly where they go, I don't know if it's my imagination, but I really feel like I've got better control. Whereas other people, it's like it's just slow little progressions, and we go through a list of things at the start, and at the end, you go right. So, do you wake up at night to go to the toilet? Do you go looking for a toilet when you're out? Do you still leak when you sneeze or cough? Those
Mm.
sort of things. So they're little things that happen, and I love about the machine that like the connection between your brain and your bladder, because it's a totally focused energy that goes to your pelvic floors. That connection starts to rebuild again. So
Mm.
it's almost like you've got that strength there. You don't start to panic. You just stop. You breathe. Breathing's a huge part, the breath work, in terms of getting your pelvic floors back as well. But it's just so empowering, and so like I've had some really lovely stories. And as a health practitioner, I just love the fact that you get to make a difference to someone's life, also in a different way. And incontinence is just like so socially isolating for some people. And it's just fantastic that you get to make a difference to someone's life. Like they don't have to stop like 4 or 5 times to go to Melbourne. They can go to the movies and watch a movie and not have to think that they're going to have to get up and go to the toilet 3 times. Like they'll go out to dinner or they'll go to social functions, not worrying that they're going to, wet themselves. And especially for men, I'm not trying to dismiss women's, but I think women, because we have, your period, and you get used to having pads and, tampons and, having to wear products. Whereas men, it's just like almost demasculating, I think, in
Mm.
them having to use pads. So for them, it can be a massive game changer as well. Like I know there's a couple of men that we've treated that won't go. They won't go out. They won't leave the house. They won't wear pads because it's embarrassing. But then they'll just keep changing their pants all day. So
Mm.
for those sort of people, it's really lovely that you can make such a difference for
Yeah, that's amazing.
them.
Um, and it is very rewarding. Have you got a case study or I guess a success story that you can think to come to mind that has been really successful in terms of using the M-Seller and having, great, as you say, great success and really rewarding outcomes?
Yeah, I've got a couple actually. Like a 69-year-old lady that had like a partial prolapse,
Mm-hmm.
and she came in with her husband, and they're the loveliest couple. And he was just so excited that there might be something that she might be able to do, because she was starting to get really sad. And he said, she's brought up our 5 kids and she's done everything for everybody, and now we want to give back to her. And she
Mm.
got the best results. Like she's about to go overseas now on a holiday. But for her prolapse, she said 9 days out of 10, I can't even tell that it's there. Like, so she doesn't have the continence problems anymore as well. And she just said for her, it's changed her life. Like, she just thought, because I've had these, lovely kids, and they were big kids. She said, I just thought that's how it was going to be. And at the end of that, that was just beautiful.
Yeah.
There's also a recent client that's done the quarter four, and she's gorgeous. She's quite young, and she had muscle separation still,
Mm.
and she had a lot of lower back pain and some leakage as well. And she was getting really upset because she was getting back pain every day, and she had about 3 centimeters abdominal separation um, after she'd had a little child, and they're now about 3 or 4. So she actually booked in for some surgery, but was on a wait list. So the wait list was like 18 months to 2 years. So she said, I've got nothing to lose by
No.
trying this. So we did the quarter four, which was the M sculpt on her abs to rebuild that muscle and retrain the muscle as well as get the strength back there. and get rid of that muscle separation, and also work on her pelvic floor. So now she doesn't leak. She's had no back pain. Probably after the third treatment, I think she said the back pain. She moves well. She moves much better. She said, "I've been in the garden doing digging and stuff like that." She said, "I've had no issues whatsoever," and she's just wrapped, absolutely wrapped in the service, because she used to be a runner before she had her kids. And she said, "There's no way I could run with my back pain." And she said now she's going to take it very gently, get back on the treadmill, and then start running again. So, like, for that, that's like a, you know, mid to late 30-year-old that's actually now getting back into doing things that she loves. Got
Yeah.
rid of her back pain. We've got her muscle separation down to half a centimetre. And then we've got and for the treatment, it actually keeps working for the 6 weeks. So you don't see the final result for the 6 weeks. So when she checks back in at 6 weeks' time, we'll measure that again. But just so keen and so happy in herself. She was so upset, like the first appointment, and she was just glowing, like when she left after the last one. So that, that's fantastic. So not only is she improving her mental health and like getting back and being active as well, she's got rid of her back pain and her muscle separation. So fantastic.
It's amazing. That's fantastic. It's
Mm.
so not just about health, isn't it? Like
Oh,
in anything that we treat, for that to, it kind of gave me goosebumps hearing that young girl is going to get back to her, her pre-baby desire and love
mm,
for
mm,
running, and not
exactly.
only is that amazing for her own mental health, but
Yep.
just for her to be able to, like, it's just had more of an impact. And I'm sure as she's getting more confident in her getting back to her old self or new self, however we want to describe it,
Yeah,
you
definitely.
know, she's a better mum and a better wife and a better person,
Yep.
for it. But just by working on the pelvic floor,
Yeah.
core, she
Yes.
she's had other outcomes that don't just relate to her health.
Oh, exactly. Like your mental, like everything is so connected. You know that with your health as well. So
Mm.
if you're starting to get really distressed about that, then everything starts to fall into place, and you can also hold a lot of stress in your pelvic floors as well. So people that have quite tight pelvic floors, and especially A-type personalities, or um, people that are really holding a lot of stress for whatever reason, you can actually hold that in your pelvic floors. And that's something that you need to address before you can actually use the machine, because the machine's only going to tighten that even more and cause more problems first during incontinence. So that's why it's really important to have an assessment.
Yeah, that's
Yeah.
awesome. That's amazing. I was going to ask about how stress does really impact it, but you've kind of just answered it. It does hold, as you say. So
Mm.
essentially, overhold your pelvic floor, and be too tight.
Yeah,
Yeah,
absolutely. Yeah. So it's
that's
like if you hold it in your shoulders, you can hold it in your pelvic floor as well, and that can affect your intimacy with your partner as well, and then that's just a cascading effect as well. So
absolutely.
yes, there's just so much to
Mm.
learn about your pelvic floors. It's crazy.
Yeah, there is absolutely 100%.
Definitely.
Um, eh, let's let's talk about some recommendations for some resources or tools. So, obviously, your website would be fantastic to jump on and have a look at. But
Yeah.
are there any other resources or tools that listeners could that you would recommend to use for patients who are just starting to explore what's not normal?
Yeah, definitely. I've done my research as well, because I do follow a lot of people and I get a lot of information from them as well. But I just, this is probably more menopausal women, I think, but more so, like, it's actually for any woman. I'd absolutely love, her name's Louise Newsom, and she's a gynecologist from the UK.
Hmm.
And she's been like really pivotal, I think, in bringing menopause to the forefront and all the myths and everything that go with that as well. I think she just gives you so much information that actually makes you really think about being more proactive and not just going to the doctors just because, and taking them for granted. like it, that they would know what you're talking about. You have to really be, I suppose, your own champion. Go in with your research as well.
Mm.
Um, there's a lot of there's another lady called Dr. Claire Haver, and she's got a book called "What's the Menopause."
Mm-hmm.
That's a really really good read as well. But there's a few other devices that you can get called the Squeezy or the LB Trainer, and
Oh
they're
yeah.
actually devices that you insert and that connects to your phone, and then you'll get biofeedback from like how well you're doing your pelvic floor muscles. It's almost like, that sounds weird, but like a little game where you get, yeah, you're doing really well, big thumbs up, that sort of stuff on your phone. So that lets you know that you're actually doing your pelvic floor muscles correctly. And I think a lot of people, especially, think that they're doing them right, but they're actually not doing it right. And so that's why a pelvic floor specialist is always really important to give you
Mm.
those tools as well. There's a few apps called Balance, and that's by Dr. Louise as
Right.
well. And there's also another one called iDry, and that actually gives you, it's a bit like a bladder diary, and it gives
Mm-hmm.
you some tips as well into tracking where you have issues, and maybe you can make that association as well with, like, this is even super simple. If you take a sneaky wee in the shower, then your brain and the running water all becomes connected as well. So it's just being really aware of what you actually do around
Mm.
your, when you go to the toilet, things like that. The Continence Foundation of Australia is fantastic. They have a lot of information on their website as well.
Fantastic.
And also, the government offers it's called CAPS funding, which is a continence aids scheme that puts money towards. So if you need pads or if you need consults, it's 200. It's actually gone up to $694.80 a year.
Wow.
So you sort of access that through your GP as well, and that's there for you to use with whatever you need in terms of your continence. So I think we're getting better. We're just not there yet, and I think
Mm.
it's really hard because a lot of our medical field is very male dominated.
Mm.
So I think getting that information out is really, it's taking its time, but it's getting there. I think it's starting to become more to the forefront, I think, for women, which
Yeah,
is
I think as you say, the younger generation is much more empowered now than
mm,
particularly I know. I look at myself and then I look at my mum, and there's a vast difference between what access we have and
mm,
b empowerment. I was really lucky that mum did empower me to ensure my health is always at the forefront, but
mm,
it doesn't. I don't say the same for her. She certainly is very still in that.
mm,
She's always looked after us before and we generally do, but I think the trying to find a balance between managing a beautiful family and
mm,
putting their health first before then
mm.
ours is
Yeah,
still a very big challenge. But I think it's a combination, right? It's a combination of access. It's a combination of GP male domination and they have 10 minutes. They literally have 10 or 5 minutes where
yeah,
they
yeah,
can't have
definitely.
a conversation and you go and have a talk about some. There was a study recently just about a weight loss. You know how I'm specialized
Mm,
in weight loss.
mm,
There was the study says that it takes a woman 9 times to make a doctor's appointment or a nurse practitioner appointment
mm,
to then have a discussion, be brave enough. They'll make the discussion around weight loss,
mm,
the appointment around weight loss, but they won't have a discussion. They'll then, go, oh, I just need a script for this, or,
mm.
and it's really interesting in terms of, then it's our values. I don't want to spend. It's financial
Exactly, yeah.
challenging, and
Yeah,
healthcare there's a very big broad range of or diversity. There's people who've got money or private health insurance who can afford access, and then there's people who don't have money and are waiting on a
correct, yeah.
wait list for 12, 18 months just to see a gynecologist.
Yeah, definitely.
it's not all not one fix is everything, unfortunately.
No, and like you said, for you and me, like I'm not direct, but I know what I want, and I know that I can go in and have that conversation with my doctor, possibly because he used to be a registrar back in the day. But you've got to have a great. I think you've really got to find a great doctor that you get a relationship with, that you are really comfortable to have those conversations with, because you need to have those conversations. It's really important. I know it might be a bit confronting, but it's just, you just need to. I can't, like, you'll do it and then you'll think, what was I so worried about?
Yeah, that's exactly right. And
Yeah.
then there's the opportunities to not, to not just go and see a GP.
Mm.
I mean, I'm not encouraging people not to go to see a
Yeah,
GP.
yeah, yeah.
There are like there's things like people like yourself. There's people like myself who deal with women's health. There's pelvic floor physiotherapists. There
Definitely.
is a vast, as you say, there's pelvic floor specific expertise out there in the community
Yeah,
that can then guide you on those starting.
absolutely. Yeah, in the right direction. Yeah.
Yeah.
And don't think that you're alone in whatever pelvic floor condition you've got, because I guarantee you are not. Absolutely, 100%. There's so many people out there that are having issues that are just, it's become part of their everyday life, which is really sad. It doesn't need to be like that.
No, I still remember a conversation with a lady a few months ago. I just a general initial assessment for her general well-being,
Mm,
and I always ask about incontinence and things like that. And she said, "Oh yeah, I leak all the time," and it was like just
mm,
normal. I
mm,
said, that's not normal. And she said, well, I just thought it's part of getting old. And I said, yeah, no, it doesn't have to be.
no.
Um, yeah, so we certainly had the conversation, and I did an assessment, and yeah, we forwarded her on to a specialist. But
Okay, good.
um, and the UTIs, the ongoing
Yeah.
recurring UTIs, that's
Yep.
insane.
Yep. Absolutely. And that's all to do with you dropping your estrogen and just your general changes. And
Mm,
that's actually one thing that the M seller can help. So there's got two protocols. So one is for pelvic floor laxity. And so that's
mhm,
protocol one, and that works on your slow twitch fibers. Um, protocol two works on your fast twitch fibers as well, but it also really helps get that blood flow back to your area. So it helps with lubrication, sensation, but also UTIs, because with you dropping your estrogen, and like a lot of those estrogen receptors are in your vagina, you get a lot of dryness and you get prone to UTIs, you get prone to infections, you get have painful sex, you lose, sensation and libido. So it's really important to, men can, why can't women? So
yeah, 100%,
yeah,
absolutely. Hey, I know we're starting to run out of
yeah,
time, but what I did want to touch base with, because we've mentioned it, and I know you and I have had conversations around the M Sculpt and
yeah,
the benefits using. So a lot of my patients for weight loss use pharmacotherapy
yeah.
to help lose weight, and you was explaining that there's some great research around the connection between using the M Sculpt if you are using some of the medications for weight
Mm.
loss.
Yeah, definitely. So with your weight loss, you'll also get some muscle wastage as well, because you're definitely, like, you're not eating as much, you're probably not moving as much. So it's really important to make sure that you maintain your skeletal muscle. So that skeletal muscle also helps with your metabolism, because the more muscle you've got, the more like you're better off your metabolism is. So it's really important to incorporate muscle building, whether you're going to the gym. But if you're not able to do that, like, you can use the M Sculpt as well, because that gives you like great results in terms of rebuilding your muscle. And it's also, we've got the Exilus as well, and that works on like skin tightening, because you're also going to lose a lot of elasticity in your skin as you're losing that weight. So it's really important to incorporate that as well, especially around your face,
Mhm.
but also in areas where you found it really hard to move that, like especially with it's called your mum tum, which I think sounds terrible, but
Yes.
so your lower stomach is that's also got a lot to do with your pelvic floors and your posture and everything as well. But it can really help to you know target those areas that you find it really hard to get rid of that, while also giving your skin tightening, which is one of those unforeseen things, not unforeseen, well, I suppose one of those unfortunate things that happens when you do lose weight and you've had, that weight there for a little bit.
Yeah, absolutely. And probably particularly for the M sculpt sounds fantastic also for the weight loss surgical patients as well, I would imagine.
Oh, absolutely. And it
Yeah,
also, like, it rebuilds your muscle, but it also, because it's rebuilding that muscle and you get that strength, it does change your shape as well. Like, it
yeah,
definitely
great.
does change the way you stand, but also the way clothes fit, the way, like, the weirdest thing is, like, your belly button moves up because everything's gone up because we've tightened everything. It's just, yeah, it's really interesting. So I always say, oh, yep. And I've seen your belly button, like, when you sort of, your belly button's a bit closed, and then when you've got some, length in your body, that you actually start to see your belly button again, like funny little things like that.
Yeah, no,
But
that's
yes,
amazing.
it's great because I love that it gives you your confidence back, and it
Mm.
gives you that ability to be able to get back into doing whatever it is that you love doing without causing yourself an injury because you've got that strength in your core.
That's amazing. So, if this has been such an enlightening podcast,
Oh, thanks.
I think it's going to be really, really well listened to because so many people. I think it's such a taboo topic, and I'd love to talk to you more another day, and we'll get into the nitty gritty of maybe some of the machine work
Oh,
and what
definitely.
benefits it could definitely help with.
Yeah.
Um, to sign off, tell us how would people find you? How do we know about your business?
So I have Better Bodies Studio. So my base is in Bendigo, but I've sort of branched out to go to Echuca at the Holistic Care Collective, and also in Crang at Avenue Health. So I love the fact that there's a crossover of a lot of the services that can benefit, um, your well-being and your health. And I love that it is holistic and it's your body repairing itself as well. And yeah, I just love it. I still nurse as well. I don't think I'd ever not be able to nurse, but I really do love, the in and out of doing this business as well as doing the nursing. It's a great leveler. Mm.
It's fantastic. And again, we must get you back on the podcast because we're going to do a women in business podcast. And
Oh,
I think that it's really challenging as an RN and an NP going out into your own private practice
mm,
and getting started. So I am looking at doing a women in business podcast. So
yeah,
um,
that'd
be
be
soon
great.
I'll get you back on for that one as well.
Because you don't
Um,
know what you don't know until you're there, and you're like,
oh
I know
gosh,
so little.
absolutely. It just felt so lonely for me. And I still to this day make mistakes.
Yeah.
But yeah, it's been so lovely to have you on
Thank
here.
you.
So
Thank you for inviting me.
yeah, no, I'm looking forward to it. I'll pop all the information for our
Mm.
listeners down below in our show notes for all of the resources that you suggested,
Yeah,
and I'll also pop a link to your website and how they can find you on Instagram and social media.
yeah.
Um, thanks so much for joining me. We'll see you soon.
Thank you. Thanks, Beck.
Thanks so.